Cancer Holistic Guidance, Part 19. Dr. Dilip Gadgil, Pune. The most important thing is that we need to make people aware of the fact that allopathy, surgery, chemotherapy, and radiation are not the only treatment options for cancer. Finding the root causes, preventing them, and reversing them is a better approach. The destruction of cell concept can be applied to a certain extent along with that, but it cannot be the main line of treatment. It is okay if the doctor suggests chemotherapy for destroying the cancerous cells, but it has to be accompanied by understanding the disease and its causes, improving the lifestyle, focusing on diet and nutrition, using Ayurvedic or homeopathic medicines, and practicing regular yoga. However, the entire society believes that the allopathy approach is correct. People don't even know about any alternative methods of treatment. I feel that they should at least be aware of my perspective. Once they know all sides, they can then think about it and make an informed decision. Getting indigenous cow milk was a big problem until 4 to 5 years ago. However, its availability is now increasing, which is a good sign. Organic food, however, is still difficult to procure even today. If we decide to rely on organic food only, there should be no problem in finding it in a city like Pune. The state of affairs is improving across other cities, too. But the usage of indigenous seeds is still very low. An effort needs to be made towards embracing natural and organic food. What is also important in the case of cancer is the patient's mental state. If the doctor feels that the problem is serious, they suggest sonography, CT scans, PET scans, biopsy, FNOC, fine needle aspiration cytology, etc. Not a lot of people know about FNOC. In this test, the fluid is taken out of the body using a needle and studied in the lab to determine what kind of cancer the patient is suffering from. Biopsy, on the other hand, involves removing a piece and examining it in the lab. When the doctor says that the problem seems serious and needs to be investigated, the patient and their family start panicking. People generally relate biopsy with cancer, so the moment they hear biopsy they assume that they are doomed. Fear sets in even before cancer is diagnosed and the treatment begins. If it is in fact cancer, how do we deal with it? Cancer has a tendency to make people panic. There is a notion that once the cancer is diagnosed, life becomes miserable and the expenses related to the disease are extremely high, too. It is imperative that this fear is taken out of people's minds first.